My name is Dr. Lily Tsai,
My name is Tsai Lombardi.
and I'm a minimally invasive gynecologic surgeon based in San Diego.
I am a physician practicing in OBGYN. I specialize in minimally invasive gynecologic surgery, so I have expertise in performing laparoscopic and robotic surgeries for patients.
I've always been interested in women's health in general, but especially being an advocate for women. I was a women's studies minor in college, in addition to being a major in biochemistry. And I did a lot of volunteer work with the Rape Crisis Center when I was in college. Eventually I worked for Planned Parenthood during my gap year between college and medical school, and further expanded my interest in women's health and advocacy. Eventually when I got to medical school, I was very much interested in surgery, but also with the women's health obvious bend, and that led me to OBGYN. I think it was a natural fit. Eventually in OBGYN, I gravitated obviously more towards the surgical side of things, and now my practice is 100% focused to gynecology, specifically a lot of benign gynecologic conditions throughout the women's health and reproductive life.
My favorite aspect of treating these gynecologic conditions really has to do with educating women. I would say that patients understand the processes that are happening to their body, the conditions of impacting them, to really get grasp of what's happening to their body. Many women, again, have not received the best education in terms of anatomy, what's normal, what's not normal. This is very important to me, again, knowing that when a woman leaves my office, she is completely understanding of what is happening to her body and is understanding of what choices she has available to make these proactive choices regarding her health.
Every patient is unique, both in personality and character, but especially in their physiology. So there's going to be some commonality, right, between what fibroids look like, between what endometriosis appears to be, but every patient is a different puzzle. So the surgery requires basic knowledge, also the artistry, figuring out how to piece together that person's case to get them the best outcome. In particular with Da Vinci, it allows you that 3D visualization, it allows you the manipulation, the fine dexterity with your fingers to make the fine-tuned decisions and interactions with that physical space.
The Da Vinci robot is a fantastic tool that allows us to do very complex surgeries laparoscopically, where in previous years or in a setting where the Da Vinci wasn't available, many women would be only able to have a surgery through an abdominal incision, a large incision. This can significantly impact recovery, healing, pain after surgery. So being able to offer women with these more complex conditions the option of having a minimally invasive surgery is so fantastic and is only beneficial for them in terms of their recovery and overall quality of life.
The main thing that our clinic offers and my clinic offers is a very directed patient-centered experience. Not only from the time that you arrive to the clinic and you're greeted through our medical assistants all the way to going through your case individually with me. The other thing that really sets us apart is that we are high volume surgeons. So in the community as general OBGYNs, just because so many OBs are working on the obstetric side, very few I would say are doing enough surgeries to keep up those skills at a high level. But we are doing those day in, day out, and our complication rates therefore are fewer because of that. And we're happy to see the complicated cases. We're happy to work through complex patient scenarios to really get the best outcome possible.
We have 2 fellowship-trained minimally invasive gynecologic surgeons in myself and Dr. Tsai. Many practices can say that they have surgeons who perform minimally invasive surgery, robotic surgery, but in many cases they do not have formal fellowship training. There's a lot of value in this in terms of proper management of different conditions, how you're managing these conditions. So that is definitely one of the standouts with our practice, is having the fellowship training behind our skill sets.
I really entered the field because being good with one's hands lends you to certain types of fields in your work. But in particular, there are certain conditions in women's lives where I think are underaddressed. And some of those include pelvic pain, abnormal bleeding, and specifically endometriosis. And all of those lend well to doing minimally invasive GYN surgery.
We decided to partner up to run this clinic because we both trained at the same fellowship program. So we were very able to work very closely together in the early stages. I'll say personally in the early stages of my career, looking to Dr. Tsai as a mentor. So being very comfortable with each other, knowing that we are managing these conditions in very similar ways and that we both have the same passion about treating women with these gynecologic issues. So it seemed like a natural fit that we would work together to run this clinic.
There's nothing better than treating somebody who has a chronic condition, helping them feel better, whether it be through surgery, whether it be through medical management, and helping them be more engaged in their life. It's amazing.